In sub-Saharan Africa, women play a pivotal role in their families and communities. Women nurture children and care for the entire family. But when it comes to healthcare, women are sometimes the most vulnerable. In most parts of Africa, poor maternal health remains a major concern. The problem has been attributed to the lack of access to sufficient professional and affordable maternal health care, resulting in the increased patronage of traditional birth attendants.
Most of the deaths we realized were coming from the communities. You could have a ruptured uterus, you could have a retained placenta, and most of them die. Some will bleed and die. And so we decided, okay, fine, we're going to engage the traditional birth attendants, take them through some form of sensitization. And I think that is where the collaboration began.
Moved by the need to promote safe delivery and reduce maternal and infant mortality in the northern region of Ghana, Christian Children's Fund of Canada, now Children Believe, launched the Promoting Maternal, Newborn, Infant and Child Sustainable Health Efforts, christened the PROMISE Project, which was funded by Global Affairs Canada.
CCFC-PROMISE Project was set out to help or to contribute to improving maternal and child health by reducing maternal and child mortality in the northern region.
For you to appreciate the issues in all the three countries, Ghana, Malawi, and Rwanda, for every 100,000 deliveries, about 460 women died. The fact is that, to the extent possible, no woman should die because of delivery.
To be able to make any level of impact within the health service delivery, the CCFC-PROMISE team first needed to tackle the human resource gap within some of the facilities.
You know, we don't have midwives everywhere. And before they are coming, we had a lot of community delivery through the traditional birth attendants. So Ghana Health Service introduced a particular program. So CCFC came in, they saw that as a project worth investing in. So they were able to reproduce the manuals and the training materials. And then from their districts, a number of these non-midwives underwent that training to build their capacity to be able to conduct safe deliveries at their operational areas.
The data at the Regional Health Directorate showed that only 25% of the midwifery workforce needed in the region were actually available at the time. So to help bridge the midwifery gap at the time, the PROMISE Project collaborated with the Regional Health Directorate to train community health nurses and enrolled nurses in midwifery task sharing so that they can provide the services where there are no midwives. And where there are midwives, they can also support the midwives in the delivery of the services that they provide.
The CCFC-PROMISE Project training on task sharing, I benefited it, that was in 2017. We started the deliveries October, November, December. We were able to deliver 14 women successfully. Both babies and mothers were all doing good. 2019, the whole of the year, we delivered 138 pregnant women.
There are very few midwives in Ghana Health Service, especially in remote areas like ours. And when it comes to maternal and child health, it's a critical area that we don't want to joke with because it deals with life. And as the situation was, very few had the training, the formal training in school. But when you come to the field, there are enrolled nurses, there are staff nurses, there are other community health nurses who haven't had that training but could be of support should the knowledge be imparted to them also. So CCFC saw the need that why don't we use these people, train them, equip them enough so that they add up to the workforce when it comes to midwifery and then maternal and child health area. So that is what they did, and it has worked perfectly for us.
But although the task sharing training had equipped the nurses at the various health facilities to handle all maternal cases, traditional beliefs still pushed most pregnant women to the doorstep of traditional birth attendants. To curb this practice, CCFC-PROMISE supported the training of care groups to further educate the women and traditional birth attendants within their communities on the need to refer pregnant women to the appropriate health centers.
Delivering women at the community level and taking fees for such were the main source of income for most of the TBAs. So to ensure or to institutionalize and the operation of the TBAs as link providers, we provided training in other income generating activities such as school making, winning mix preparation, and the rest for these TBAs. So they are able to do this at the site to generate income for themselves, whilst also supporting in the provision of linkage between the communities and the health facilities.
Yengwa do amara kamfani torda min bien ka so do ayengo karkala bi ma kan ka kom ngbro te me be meeting yen non shem nto fa bi ma nyevul bahay ka bi ma ko ngonyevul to pompongo me pa ay kulan wol sara ka te yelo ko kanate npo ambulance ma ka te paga ship to puni halo yi do ame ka bi ma bin sha kam yen no bin sha kulan no pompongo da fa na ma.
They were based on the ideology that if they don't pregma me, that was the term they give to it. If they don't announce my pregnancy, I won't come to the facility. And that one has caused a lot of maternal deaths. CCFC interaction with us and their support made us to hit march on this, which made so many mothers to be able to access ANC alongside their culture.
Azara Nu first came to this health facility upon advice from a maternal and child health volunteer. She now frequents this facility to check on her health and that of her unborn child.
Since CCFC-PROMISE Project came in, they've been able to support us to go to the communities, to talk to the women, to convince them about the importance of antenatal care.
Through the community engagements by the PROMISE Project, they have come to understand that some of the complications during pregnancy could be avoided if both the husband and wife know the importance of early antenatal and postnatal care.
Now the men are even more convinced than the women. So they usually support their wives, come with them to the facility to assess healthcare.
If the woman comes to say, the nurse said, my blood is not adequate, I should eat meat, I should eat eggs, they will say you are telling lies because you want to eat it. But when the man is present in the consulting room and then the nurse says, oh, you've seen your wife, we've checked that the HB is very low. So this is what and what you should eat. When the man goes, he will encourage the woman to eat those things and he will provide.
Because of CCFC-PROMISE, they came and they have even organized some community. We have some groups they organize in their community, and we all agree in the community that nobody should deliver in their house. And because of that, every lady is coming for antenatal care and then postnatal care.
To guarantee that these women who go with their husbands to the health facilities do not lose trust in the health delivery system, the CCFC-PROMISE Project ensured that each health center received a regular supply of essential medicines.
Since they came every year, there has been numerous donations of essential medicines. We normally discuss the list of the medicines, those are very essential to us, and then they procure them, and usually the donation is done at the regional level, then we distribute it to the facilities.
Before the PROMISE came, it wasn't that easy for us because we were lacking most of the logistics, more especially the routine drugs. We were not having multivite, ferrous sulfate. Sometimes even if we have few, the next meet is finished. So when they walk from far distance and come, and you don't get them to give them, most of them, when they go back, they feel discouraged to come back next time. So it's difficult. When you even go, they will tell you that, is there a need for me to come? If I come, you won't get drugs for me, so there's no need for me to come.
How will you feel when you visit a facility and then only for you to be told that, well, we don't have, you have to go and come back another day? I don't think you will make it.
Malaria is one of our issues in this district. It is the topmost in the top 10 diseases. So when CCFC started with us and mentioned that they had anti-malarials to give to us, I got more than overwhelmed because I knew that was just the point in Nanumba South they were hitting at. They gave us ACTs, they gave us SPs, they gave us iron drugs, they gave us dewormers, a lot, such that we distributed them to our people, and since then I think we've been okay.
Beyond the medicines, the PROMISE Project also donated a range of other medical equipment to several facilities within its operational area. Despite all these interventions, some cases involve complications that needed greater expertise and hence had to be referred to a higher facility. This is where the PROMISE Project's tricycle ambulance came in handy.
At first, when you are referring a woman, it's a critical condition, and you've assessed to the point that you know that this woman needs urgent attention. You just call the hospital, they give us the guidelines as to what we can do as a pre-referral measure. And then we give to the client, and then we immediately call the motorcane ambulance to come and pick the client to the clinic.
If you are a woman and you are in labor, how you get to the health center is your headache. So these tricycles have come to support women to be able to access maternal and child health services. And this will go a long way to reduce maternal mortality, because most of the people delay in getting to where they can render services to them.
Referrals in from the peripheral facilities that benefited to the municipal hospital, totaling 1,176. And so what it means is that if those tricycle ambulances were not available, we would have gotten most of these women losing their lives.
But the pregnant women were not the only ones affected by the long distances. Community health nurses who needed to make follow-up checks on expectant mothers within the communities and also undertake immunization activities badly needed a means of transport.
The motorbikes that were procured for us has supported us so much in terms of supervision, in terms of outreach service. And they're able to visit their communities monthly as expected.
There were times you don't have the capacity. Imagine we have like 54 communities. That is our catchment area, Savulgu sub-district. So in a month, we don't have the power to reach out to everyone. But when they came, they gave us a motorbike. Every month, we are given fuel to go out. Assuming you used to cover like 20 communities in the month, because of the support they have given us, you will be able to cover more than 20 communities. If it comes to the immunization of children, you cover a lot of children. If it comes to the family planning, you cover a lot. If it comes to the ANC, the pregnant women, you cover a lot in a month.
The PROMISE Project also supported to train pediatric nurses to provide care for the newborn and children under 5.
Ghana College of Nurses and Midwives introduced a program on people specializing in pediatric nursing. CCFC, again in their districts, they sponsored a number of general nurses who went to have that training at the College of Nursing to improve their skill in nursing services.
So the PROMISE Project, in recognition of the need for specialist care for children in the northern region, we sponsored 6 nurses to be trained as pediatric nurses. But then we also detected that they did not have the essential equipment they needed to work with, to provide the essential services for which they have been trained. So the PROMISE project, once again, with the approval of Global Affairs Canada, provided the essential medical equipment that the pediatric nurses need to provide care to children in these 3 districts.
We want to commend CCFC again for building the capacity of 2 of our nurses in pediatrics. And in fact, they paid the fees, the total amount involved, provided them with some logistics like laptops and what have you.
As part of efforts to reduce infant mortality, mothers are taught to practice delayed birth of the infant, exclusive breastfeeding, amongst other things.
You know the Venus caseosa, that yellowish substance you see on the babies. Now they've understood that that can serve as a shield, a protection shield for the child. Give them warmth, protect them from infection and even bad weather conditions.
They told me that the time that I gave, I should wait till the following morning. The time that I delivered, that was the time that we bathed the child.
You should let the first-time mother understand that the baby is supposed to breastfeed continuously and even exclusively for the first 6 months before she introduces any complementary feeding to the child.
Anko zang le betu le shelter bi karanye sharga to wanang bangne ka barga ka che dorche hamanye la sami.
Even if you deliver twins, the 2 breasts can still breastfeed them without any additional substitute for 6 good months. That is exclusive breastfeeding before you can go into complementary feeding.
The timeliness of data entry and submission is critical in healthcare delivery, but with the paper-generated system, this process was painfully slow until CCFC-PROMISE stepped in.
The data management at all these facilities we sought to support were mainly paper-based. So to help in their data management and reporting, we provided laptops and desktops to these facilities. In all, we provided 45 of these computers. Again, to improve their capacity to be able to make use of these laptops and the desktops that we have provided, we linked up with the Regional Health Directorate to train health staff of each of the 9 health facilities where we implement the PROMISE project on DIMS 2.
They gave us capacity training on DIMS and we're entering the DIMS from the facility. Previously, it has been a challenge to the district, that is the municipal now. They have been entering it at the municipality. But now, to the local aspect of the facility, we are entering it because of the training given by CCFC.
Collecting data was always a problem in the chiefs compounds. CCFC supported us with computers, and these computers were given to the various CHOs. Now we have trained the CHOs and they are able to enter their data at the chiefs level.
Through the community engagements spearheaded by the care groups, more and more men are beginning to open up to the family planning options.
You can bear with me. I think if you are able to sit down with your wife to discuss a lot of the issues that you have within the household.
Before CCFC-PROMISE came in, we were having a lot of issues with the communities with regards to family planning. Most of the men did not believe in it, and most of them had a lot of problems with their wives whenever they come to the facility to have family planning session with our midwives. CCFC-PROMISE made it a point that our focus should be on the men.
The chemika dundong nyarsiti nyimpagma mine ayidana. Ko dinun ka family planning bien. Nti hasashel kamza ha ay bor na mino bien. Yem bien me. Ama dinun ke benang le.
Dangle nena ko ye shenyela. Nye tabzan chang mbema mini beba susune min baba susune. Do me shi promise no tena bagote san chang family plan ye to apple. So family plan ma mi wura. Ah bon ko tena ka tata je na tu haye. Abibele nzer ka aje na gbani yel aidana. Beki ka banzir ko ka je na yel aidana. Dinu mazaha do ma je ma kar no talahi. Kana chom die sabta bang sam nam pahni pung bob shela zo. Kana nan chom bang ni enterba banze shani enjoy so shela. Kabima to mal alafi kama yaba nang bana fu.
They have a whole lot of misconceptions that when I do family planning, in later years I won't be able to make children again. Some say it will travel to your heart. Some say it makes them impotent, demand. A whole lot of misconceptions. And for that matter, it deters the others who want to come for those products. But when Promise CCFC they came, they gave us the power to go out, because we were always supported every month to go out to the community. They have some communities that we go together, community members, talk to them about the misconceptions to clear their doubts about it. So because of that, we now have a good number of people patronizing it.
Numbuya taya tin mangi ga nambia tina makanyir biyabo biya yak be wimpam and Santa Fala tang man jobe awe bikinyi nyowe bikinyi ga findu weton ana chachi na man pala nda ko jobe nyana nyane tungo jo mangir ba to gur makaningirte katang man ko jobe ya ga balafi.
There's a group we're calling adolescent health groups, and we were meeting the adolescents of the community, both male and female. We try to interact with them. We're having videos to make them see, those who are at the teen age and get pregnant, what are the effects on them.
As a stopgap for malaria, cholera, and other communal diseases, Promise Project, through the Community Action Plan, educated various communities on the need to construct pit latrines in households to help improve hygiene.
We, the 25-member group, they always come to organize us, and they will educate us about our health, so that we will also send it across to the rest of the community.
We took the sanitation aspect very serious. We constructed latrines, every house a toilet, and throughout the last year, we did not record much illness among children in sending them to hospitals for malaria and others. So it means it has brought even money to us.
First, when there is no latrine like these ones, people were falling sick in the rainy season. But now that we have trained to construct small latrines in our houses, I think it is very helpful, and people are no more falling sick in the community again.
Through Promise, all the communities within the project area now understand what a 4-star diet means and how it can be achieved.
Even though when they go for outreach, they give education programs and those, but it's like it wasn't getting to them. So when CCFC came, we had this group, that 25-member group that they formed, and every month I moved to the community level. I meet this 25 group, that is the 4 communities under our catchment area. Then after that, they will also move to the various houses and then give sensitization to the people, those who were not able to come for the meeting.
So the food demonstration we did so many times made them to know that the food we are cultivating are equally the nutrient-dense foods that we are selling to the people in the market. Why then we make good use of it?
At first, we didn't know anything about it, but when they came, they taught us how to balance our diet to giving birth.
With the impact made within the few years of its operation, the Promise Project has touched many lives and brought smiles back into the faces of mothers, their children, and entire communities.
Thank you, CCFC. Thank you, CCFC Promise.
Thank you, CCFC Promise, for your support.
Thank you very much, and God bless you. Thank you, and God continue to bless you.